An electronic health record is a system that enables healthcare professionals to document patient information such as medical history, head-to-toe assessments, lab results, diagnostic tests, healthcare notes, and to store it for future reference. Electronic health records are usually only accessible by one facility, although some records are synchronized between hospitals. The goal of electronic health records are to deliver high-quality care to every patient. The data elements of electronic health records are used for the purposes of quality improvement, population recording, and clinical research. It can also be used to form and evaluate health statistics.
Electronic health records can be accessed on any electronic device, such as a computer, a laptop, or a tablet. In many hospitals, you'll see computers mounted on wheels that can easily travel from room to room. And some hospitals may even have computers in every room. However, to access electronic health records on any device, the software that stores the information needs to be downloaded to the device you'd like to use. And you must also have ID access to the software, usually in the form of a username and password. And without these, you will not have access to an electronic health record.
So there are many advantages and disadvantages to EHRs. Some of the advantages include they're accurate, up-to-date, and they have complete information about your patients. It allows for quick access to patient records, and it's more coordinated and efficient care. It reduces medical errors and helps provide safer care for your patients. And convenience of access for healthcare professionals is better. It's more reliable than other methods of recording, and it's cost-effective.
Some of the disadvantages of electronic health records are that there's a major security and privacy concern. There's also a lack of synchronizations of medical records between different hospitals and facilities that use different systems, perhaps. So if a patient were to go to a different place that uses a different healthcare system or electronic healthcare system, they wouldn't sync up. There's also a high startup cost for electronic health records. A computer crash could wipe out the data that has been stored. Medical records that have been stored for several years. It could also jeopardize care for patients. There's also concern for identity theft and fraud can occur. You have to set aside a lot of time and for training for the use of electronic health records. They can be kind of difficult to understand for nurses when they're trying to adapt to a new charting system, as well as older nurses who maybe aren't as good with technology. It can be harder for them as well, going from paper to electronic.
Just going off of some security and privacy concerns, if confidential records end up in the hands of a person who's not privy to that information, the consequences can be really overwhelming. Identity theft can occur, which can destroy a person's finances and credit and their reputation, and victims of that could seek litigation against the healthcare practice in which the breach occurred. If the breach affected multiple patients, the practice is headed down a long road of legal troubles. So that's why we really need to have reputable record management to make sure that kind of stuff doesn't happen. Another security concern lies within the conversion of paper-based filling systems to electronic health records. There's a potential for misplacement of data throughout this process. However, professional electronic health record vendors formulate transition strategies in order to essentially eliminate data misplacement.